The COVID-19 Vaccine Hesitancy Report 2021 pointed out that SVG was the only country the survey was conducted not using face-to-face due to extreme challenges with COVID-19, which made in-person interaction very difficult. However, the report stated that the reasons for an early hesitancy involved a lack of trust in the vaccines on account of the speed of their development and uncertainty over long-term side effects. The major factors that convinced the respondents to get a vaccine themselves were doing more research and speaking to their doctor. According to the survey, the primary sources of information on the COVID-19 vaccine situation were government officials, sourced by a wide margin. St. Vincent and the Grenadines was the only country where social networks were the priority medium of communication. In terms of whether the use of local and international personalities has any effect, vaccinated respondents in St. Vincent and the Grenadines, 75%, were the most likely to find this useful. The all-country average was 62% in this category. Most vaccinated respondents believe in a vaccine mandate for a wide range of people, except primary school students. Only 33% thought vaccines should be mandated in this group. The chief reason given by respondents for avoiding vaccination is the contention that they don't trust it and are unsure about long-term side effects. The survey showed that an unvaccinated person in St. Vincent and the Grenadines is under 50, could be either male or female, does not work in an institutional environment, and is educated to secondary or post-secondary level. When asked if their views on taking a vaccine changed over time, 65% of the unvaccinated said no, and 24% said they were actually now less inclined to get vaccinated. Only 11% said they were more inclined to do so. The preferred mode of communication for unvaccinated persons was Facebook, followed by WhatsApp. According to the survey, the sources that respondents relied on to inform their decision to remain unvaccinated were social media and government official sources. The survey also sought to find if there was any evidence that would make reluctant respondents take a COVID-19 vaccine. Most said more information on side effects and efficacy could sway them. When asked if there were any other factors that might help change their minds, apart from more medical information, respondents suggest they might get vaccinated if it is required to overseas travel or to get or keep a job. Despite remaining unpersuaded, around 70% of the unvaccinated in St. Vincent and the Grenadines found the information conveyed by personalities to be helpful. In relation to vaccine mandates, unsurprisingly, unvaccinated respondents were much less likely than their vaccinated counterparts to support them. Agreement with mandates for students was particularly low. The recommendations from the survey are that communication strategies need to speak to key concerns, target the demographic profile of the unvaccinated, and hone the use of non-governmental personalities and influencers. Supplemental strategies should consider the risk to vulnerable groups and, in respect of younger and unemployed persons, consider promoting infotainment products that might reach this audience. Vaccination tracking is necessary to determine if strategies are working, and is therefore suggested that this exercise be repeated in another year if the issue continues to be relevant. Reporting for SVG-TV News, Larissa, kydd.